Next, we'll be going over the procedures for intramuscular injections and subcutaneous injections. The first thing we're going to do is perform our calculation. And you can see that we have diphenhydramine, which is known as Benadryl. It's packaged 100 milligrams in 2 mLs. My desired dose is going to be 20 milligrams. That's what's being ordered. My concentration from the package is 50 milligrams per ml. And as I did the math using the master formula, it came out to 2/5 of an ml. And when I divide it out, it comes out to 0.4 mLs. So as with everything else, we want to explain the procedure to the patient. You're going to say, ma'am, sir, I got to give you this medication. It's called diphenhydramine. Are you allergic to anything? We're going to be giving it via IM or sub-Q route. And for this video, I will be doing both. They have no allergies, and I got consent, so I need to know some basic information. I will be doing intramuscular first. So for IM injections, I'm going to be using a 21 to a 23 gauge needle, 3/8 inch to 1 inch, and you may be going up higher than that depending on the patient. If they have larger body mass, then you may go with a larger, longer needle. We're going to go at a 90-degree angle, and our injection sites are going to be in the deltoid, no more than 2 mLs. It's 3 fingers below the acromial process. We can also go in the dorsal gluteal, which is the upper outer quadrant of the buttocks. You can also go into the vastus lateralis, the rectus femoris, and those are also no more than 5 mLs per injection. So with the procedure, I want to look for my medication, color, clarity, sedimentation, vessel integrity, expiration date. I have my alcohol preps. I have my injection site for this, for intramuscular. I'll be going into the deltoid. I have my sterile covering. I'm going to be using a 1 cc syringe because I need 0.4 mLs. 21 to 23, so I'll be using a 22 gauge needle for this procedure. So I already checked to make sure my medication is good. I want to go ahead and cleanse the vial. Now you could cleanse it and take it off and throw it away, or you can leave it on as such. We're going to go to the deltoid. We're going to do a gross decon. And then we're going to take another alcohol prep, do a fine swipe. So you're using 3 alcohol preps for this. I'm going to grab a 1 cc syringe. Now I need 0.4 mLs, and remember with vials, we want to inject air into it. So I'm going to go to about 0.5 or 0.6. I'm going to grab my hypodermic needle. And put it on. Now with a 1 cc syringe, we got to be a little more cautious with how we take this cap off. So 2-hand pop, 1-hand drop. I'm going to marry my hands with the vial. I'm going to inject the air into it. I'm going to pull back my medication until I get the right amount. So I can see that I have an air bubble up here. I'm at 0.5, 0.6. I zeroed it out within the vial. I'm at 0.4 mLs. For intramuscular, we're going to spread the skin because we want to push the fat away. 90-degree angle. I'm going to aspirate. I got nothing, and then I'm going to go ahead and push the medicine, and then this is going to go into the sharps container. I'm going to grab my sterile dressing, a Band-Aid, cover with the puncture site, and I'm going to look for desired and undesired effects, update medical control, note daytime initials, and reassess for any findings. So for sub-Q, unlike intramuscular, where we go at a 90-degree angle, we're going to go about a 45-degree angle. And we're going to use a different size gauge catheter. So sub-Q recap, we're going to use a 24 to 26. I'll be using a 25 gauge needle for this procedure. I already checked color, clarity, sedimentation, vessel integrity, expiration date of my medicine. I'm going to open up my hypodermic needle. I'm going to connect my 1 cc syringe. I'm going to cleanse my vial. Then I'm going to cleanse my site of injection. Now for sub-Q, we could go anywhere where you could kind of pinch fat. The abdomen, the back of the triceps are really good spots for this. So I did my gross decon. One more swipe. So now my site's prepped. I need 0.4 mLs, so I drew past 0.5. I'm gonna do a 2-hand pop, 1-hand drop. Went past 0.4, so that way I know I could zero it out within that vial. Next, we're going to pinch. So unlike spreading, where we want to spread the subcutaneous tissue, we're going to pinch it now. And what we're doing is pinching subcutaneous tissue away from the muscle, and we want to go right into that hollow cavity. So a 45-degree angle, 1, 2, 3. You're going to feel a little stick. You don't have to aspirate, but you can aspirate if you want, just to make sure you don't have any vessels. Inject the medication. This is going to go into your sharp container, and then you're going to grab your Band-Aid and then place it on it.